Alrighty, I'm thinking we'll get a start now.
Hi.
All good. Hello, everyone. Good evening. My name is Christina, and this is Kerry, and we're from Craniofacial Australia. And I just wanted to quickly jump on and introduce ourselves and to thank everyone for joining our second webinar of Cleft Aware. And also just to go through a bit of housekeeping that we will be sharing this video on our website for anyone that wasn't able to attend. And also to thank PKF Foundation Adelaide for funding the development of this webinar series. And we're most grateful also to Dr. Jessica Boyce for partnering with us. So on that note, I'll hand you over to Dr. Boyce.
Great. Thanks so much, Christina. I'm delighted to be here again, and thank you all for joining. And hello to those who are watching the video later on as well. Before I get started, I'd like to again acknowledge the traditional owners of the unceded land that I'm on today at home, the Wurundjeri people of the Kulin Nation. I've had the privilege of living on this land for the last 15 years, prior to which I was in Hong Kong. I'd like to pay my respects to the custodians of the land, their elders, families, and their families, past, present, and emerging. Thank you also for keeping yourself on mute. And if you have any questions, do pop them in the chat box as they come up, and I'll read through those at the end of the session today. So today is part 2 of 4. Okay, I just saw myself freeze, but I'm going to keep going. I think I'm okay now. Of this series. So we've covered feeding, and today and the next 2 sessions are looking at different aspects of communication. Today, I'm going to talk to you about what is happening in communication more generally. So I want you to have a good understanding of how different aspects of communication are affected in children and infants who have a cleft. It's very general in nature, again, so do tune into the parts that are relevant and useful for you now. Hold on to that and take that information away with you. The reason we're focusing a whole session on this background of what's actually happening is that I think that if you have a good understanding of what is happening, you'll be better equipped to support and advocate for your child, to find the right services for what they might need, to be thinking about the different aspects of their development and asking the right questions. So let's dive in. I'm going to start off by giving a really brief introduction to what aspects of communication we're thinking about for our toddlers and our children who have cleft. What are these aspects, and what do they involve? So as with the last session on feeding, I'm focusing today on areas where cleft alone is known to affect. So of course, there may be other areas of communication that are relevant for your child, particularly if they have any other diagnoses, any other developmental diagnoses, or any other genetic diagnoses. We don't have time to go through everything that may be present in children with the cleft. So I'm just focusing on those things that are related to a cleft today, but there may be other things that are impacting your child's communication as well. Just wanted to flag that before we get into this portion of the discussion today. So what does the literature tell us? Speech. This is a big portion of the communication that's affected, and it might be the main thing that you've heard about or you hear about or you're thinking about and are worried about for your child. It's what comes up the most when we're thinking about how a cleft might impact someone's communication. We also look at the areas of language and literacy in this population. And these are the main areas specific to cleft that a speech pathologist might be involved with. What are they? Let's dive into that a little bit more. So speech refers to articulation, so where we put our lips and tongue and teeth to shape the sound and air to produce different sounds in a way that allows someone else to understand what we're saying. When we're talking about speech, we're also talking about using sound processes, so the different rules of languages. For example, I can have certain sounds at the start of words, but certain sounds at the end of words, but not vice versa. So an example in English is that the ng sound, the ng sound, I can't have that at the start of the word. So we need to have an understanding of those rules of languages, whatever language you might speak. And then we need to have muscle coordination and strength. So these are the three things that we're thinking about for speech that is understandable by a listener, which is, our goal here. When I'm talking about language, we're thinking about our ability to understand what is said to us. So that's our receptive language, and also our use of language and words, our expressive language. So how we find words to put them together, our vocabulary, our grammar, our structure of our sentences. So how we're able to use words to represent our thoughts and ideas, our needs and our wants. And then we also have literacy, which I don't think I need to explain in too much detail. So we're thinking about reading and writing here. And I've got cognition on this slide as well, sort of grayed out in the background, because it's not an area that we might overtly or directly work on in speech pathology, but it's something that absolutely underlies or influences all of these factors that we're going to be talking about today. So something just to keep in the back of your mind as well. So let's talk about each of these domains in a little bit more detail now. So what's happening in speech with speech, language, and literacy in our children who have clefts? We'll start with speech. So you're familiar with this diagram if you've attended or watched the first session. So when we talk, we have air that's generated from our lungs that travels up through to our vocal folds where the air gets converted into sound. And then the air and the sound exits through our nose or through our mouth. And our articulators, so our lips, tongue, teeth, and palate, control how that sound and air travels and where it goes. And that's how we get all the different sounds that come together to make words that we can understand. So each articulator has a different role depending on what sound we're producing, what we're saying, the types of words we're using. And I encourage you, if this is an area that's of interest to you, or if it's something you think is important or you'd like to understand better in your child's development, when you're talking, think about where you're putting your tongue, which part, where are your lips touching your teeth, what's happening? Because then you can work out, if you notice your child's having trouble with certain sounds, you can work out what they need to produce those sounds and then figure out or go and ask about what might be happening that's affecting your child's production of that sound. So what's the palate's role in this? Because this is what we talk about the most when we're looking at this population. How does the palate affect our speech? In English, we have 3 sounds that we can see. You can see here on the left that come out of our nose. So this port here where it says open port, the port I'm talking about here is this area at the back. So when we say these 3 sounds, n, and the air and sound that I was talking about before comes out the nose. So this is open. For all other sounds in English, this port is closed, or we want this port to be closed for those sounds to be perceived for them to be perceived in the way that you're hearing me say them today. This port is closed. So for that port to be tightly closed, and that then generates, then sends the air and sound out through the mouth. I need the palate to go up, as you can see, and the back of the throat comes forward to get that tight closure. If I don't see that tight closure, then we have something that's called velopharyngeal insufficiency, or VPI. And if your child is already starting to develop a little bit of speech, perhaps you've been to some cleft clinics, this might be a term that you've heard thrown around. It's a term that's used a lot in this population, VPI. So that refers to when this tight closure is not happening here. So that can lead to a sound in the air escaping out different places, and that it's going to affect the clarity and the perception of these sounds. What might be different in a cleft that's causing this to happen? There are a few different things. So we can have a submucous cleft palate, and I touched on that in the last session. That's where there's a break in the underlying muscles, but the tissue that you can see when you look in the mouth remains largely intact. That may be causing some difficulties in that closure at the port at the back of the mouth. If we have a cleft palate, that's going to affect that closure. So I'll talk later a little bit more about the repairs and how that works here. But if we have a cleft somewhere around this portion, anywhere along the palate, that might affect the closure even after the cleft has been repaired. Because we might see, this is one thing we might see, not the only thing, we might see a palate that's a little bit short, or we might see a deep pharynx. So you can see this gap here is really big. So even if that palate can move, it might not be able to reach the back to get enough closure to stop the air and sound from coming out of the nose. And then we might also see weaker or thinner muscles. So there's a whole range of things that could be happening. The main thing to be thinking about here is that we want there to be a closure to separate the nasal cavity from the oral cavity, so the nose area from the mouth area, because we need that to happen to produce sounds that are perceptually going to be differentiated. So that's a little bit of background on what's happening with speech. I'm going to talk later on about all the different surgical procedures and how they might impact speech, but that's a bit of an intro on VPI, which is a term that is used a lot in this group. So we'll move on to language now. So the literature, most of the literature looking at language in this group splits study groups into early years and later school years, primary school, secondary school years. So if that's how I've split what I'm presenting to you here today. So in the early years, so I'm talking baby and toddler age, the children born with a cleft typically have an understanding of language that's within the average range. Great. Where we see a little bit of difference is in the talking, so that expressive language. So sometimes we might see less babble, so ba ba ba, ma ma ma, da da da. We might see less of that when the baby starts to, or when we would expect to see babies to start babbling. We might see less of that in children who have a cleft. We might see slower vocabulary development and shorter sentences. And this is perhaps not unsurprising given the impact the cleft has on speech and also on hearing. So we know that the muscles of the soft palate are the same muscles that also control, also help fluid to be cleared from the middle ear. So we see, it's not uncommon to see fluctuating hearing in infants and children who have a cleft in the palate. And we need to be able to hear in order to pick up and learn our language and our speech. So that can have an impact on that expressive language as well. And this part of the slide here is also the reason why we have a whole session, our next session, just looking at early language input. So what we can do in that first year. It's so key. There's so much opportunity and there's lots of things you can be doing in that first year, even before a repair. So we're going to be talking about that in our next session. But when we get to the school years, there is what we know about language is a little bit different. I did a study looking at an Australian cohort comparing the language outcomes of school-age children, and we found that the results across both receptive and expressive language for children who have a cleft and no other diagnoses were comparable to their peers, their non-cleft peers. So something's happening here from that infancy to that school age period. But the thing to keep in mind in this older group is that there is a big spread, or there is a big range of different profiles. So overall, we see that there's the language outcomes in school-age children with a cleft are comparable to school-age children who don't have a cleft, but there's still a big range. So we still want to be, and that's why I've flagged language and why I'm putting a bit of time into talking about it today, still something we want to be keeping in the back of our mind and considering in this group. And then lastly, and briefly, is literacy. So we know that early challenges with speech and language can have flow-on effects to literacy development. There's lots of different components of literacy development, so it can have flow-on effects to specific areas depending on what's happening early on, but it might also not always be the case. So again, something I really wanted to flag here so that you have it in the back of your mind, but not to highlight it as something to be worried about, because these areas, particularly as the children grow older, generally tend to not be as bigger areas of concern. All right, so we're going to move now on to what's happening with speech mostly at, or how do these different surgeries that happen across a child's development relate to speech? What's happening with speech at all these different time points? And I'm focusing on speech because it's typically the biggest impact is of the different surgeries we're going to see on speech. And I'm not going through the general ages and stages of communication development, speech and language development here, because there are plenty of wonderful resources online for that. And this QR code here on the screen will take you to the Speech Pathology Australia's communication milestones handouts. So they have individual handouts for different age ranges that you can have a look at. So you can just find the one that's relevant for your child. And there's also a big one that goes through all the different ages and stages. So do go and look at those if you'd like to know what am I expecting from my child's speech and language. So the sounds I would expect them to be able to say by this age, how many words I would expect them to say, how many words I would expect them to be able to put together in a sentence by this age. Go and have a look at that resource online. So I'm going to talk now about the different surgeries and how speech might be affected. So back to this diagram again. This slide is going to get really busy by the end of this portion of what I'm talking about today. Lots and lots of information. So I encourage you to really tune into what's relevant for you and your child now. Take that information, hold on to that. And then you can revisit the other parts of this section later on when it's relevant to you. So hopefully, even though it's going to get a bit busy, you're still able to tune in and take what you need and what's helpful for you right now. So we'll start with the lips. So a lip repair typically happens fairly early on. It might be before or around the time which your baby starts to babble. So if it happens before, it's not going to have as much impact on that early speech development because the lip is going to be repaired already. If it's happening around the time of that babble, the start of babble, you might notice some difference in some of those sounds that use our lips or require our lips to come together, b, p, m, or require our lips to come in contact with our teeth. We don't talk about cleft lip by itself as much with speech because overall it doesn't have as much of an impact on overall intelligibility or ability to be understood by others. We can see it more. So same as what came up when I was talking about feeding, we can see it. When you look at someone, you can see that cleft of the lip, but it doesn't have as much of an impact on speech and communication development as a cleft in the palate does. So there are a few stages with palates when we're thinking about surgeries. So we might have our primary repair, however that happens, whether or whatever surgical procedure or whatever timelines are for your child for that primary repair, that's obviously going to close up the cleft. So once that is closed, we're then giving our palate the opportunity to try and get that closure. And we're not going to see as much of that air and sound escaping out through the nose within speech. So after that primary repair, you're likely to hear difference in how your child sounds. They might start saying different sounds as well. Despite that early repair, sometimes it's hard to predict how a child is going to grow. So sometimes once the child develops a little bit more speech, so usually around 3 to 5, we still see some of these features of VPI. So the palate, the initial cleft has been repaired, but we still see some air escaping. We still see some articulation that is affecting the child's ability to be understood. So at that point, we do a little bit more investigation to find out what's happening, and that may lead to another surgical procedure. So that's what I've put here, secondary surgery for speech. So that procedure is a way to help close this port during speech. And that procedure is related to speech directly. So after that procedure, in the 6 to 12 months after that, we're likely to see changes in speech again. Ideally, depending on how your child's speech, or what your child's speech is like before the surgery, ideally we're seeing less of those features that are related to the sound escaping out through their nose. And the other thing with the palate is that we can also sometimes, depending on the nature of the cleft, have fistula or holes there that that remain even after that early repair, and that can also lead sometimes to that sound and air escaping out through the nose. The next one is ears. So I've talked already about why ears are important and why they're considered part of this journey. So we might see that fluctuating hearing. So depending on the severity and the length of that lower hearing, the periods of that time, we might see different outcomes. And often very early on in children who have a cleft palate, there might be grommets inserted here as well. So that's where there's a little tube inserted into the eardrum to help that clearing out. So when we have that middle ear able to be cleared out, we're more likely to see our better speech and language outcomes, or we are then providing our child with that hearing and that rich input to allow the subsequent speech and language development to occur. Nose I've got here because it's, again, relevant. Depending on the type and nature of the cleft, I know I'm saying that a lot, we might see changes in how that air and sound comes out through the nose. So if the air and sound gets into this nose area here, and then there's either a blockage or something that's going on here that's stopping it from coming out, that might affect the underlying tone or underlying perception of how your child's speech sounds. And that might change if there are any surgeries done on the nose as well. The next one is teeth. So this is a really big one because we know that children who have clefts often have crowded teeth, extra or missing teeth, where their teeth might be misplaced or rotated, which is why, side note, it's keeping your general health of the teeth as strong as possible is so important. So that is, again, going to impact the sound of those, the perception of the sounds where teeth are involved. So the sounds that are produced towards the front of our mouth. So how might this then relate to any procedures that are happening? So there might be orthodontic treatment that happens at different stages. So it might happen across multiple different time points. And as the teeth move, that's then going to affect the clarity of those sounds that involve the teeth as well. And also we might have bone grafting that happens at a later age, so around 8 to 12, depending on development. And that again is going to affect the position of the teeth and how the sounds come out when they're produced at that portion of the mouth. I'm mindful that this is a lot of information, so I really hope you're able to just hone into the bit you need and then just see how you go with the rest. Last one is, if I can get this, is the jaw. So this is going to be relevant later, a lot later on. So we're thinking more around adolescence. So some people with a cleft have an upper jaw that's a little bit smaller than their lower jaw. So that makes the top teeth sit behind the bottom teeth. So in adolescence or early adulthood, there may be the opportunity, or it may be appropriate to have surgery to help align those teeth. So depending on the specifics of that surgery, speech might be affected as well. So if you think about the front teeth being behind the back teeth, if we're moving everything forward, that's going to open up this space at the back as well. So just to keep in mind that procedures later on too might affect speech as well. So if that space is opened out, then we're going to have a bigger gap here at the back that needs closing. Okay, I'm mindful we're almost at the 30-minute mark, so let me just power through these last few slides. So I wanted to flag here that you're likely to have more than one speech pathologist. So you have your speech pathologist at the tertiary center. So they're the cleft expert speech pathologists. They'll be part of the multidisciplinary teams, and they will check in with you and your child at different time points across their development. And they're really going to be looking at the things I've talked about today. So what exactly is happening with your child's cleft and how's that impacting their speech? What might we need to do next, if anything? And then your community therapists, whether that be public or private, are going to be the ones who you might see more regularly. And if you need therapy, they're the ones who are going to be delivering that therapy. And I just wanted to flag here that if you do have two speech pathologists, it's a great idea to keep notes from each of them to pass on to each other when you go to your different appointments. They can also communicate too, but sometimes if you've got an appointment run after the other, it's always good to have that information to pass on as well. And the other thing about the community therapists is that there are obviously community therapists who have a specific expertise and knowledge in the area of cleft. But any speech pathologist who has knowledge about speech more broadly or language more broadly would absolutely be able to support your child. Now, I've talked a lot about surgery and speech and a little bit about language. I've talked a lot about surgery today, not so much about therapy. So I just wanted to flag here that it is a careful balance and combination of both surgery and therapy that happens here. And we're going to talk more about the therapy side of things and what you might do in our next couple of sessions. We often say that as speech therapists, so I'm a speech pathologist, it's our job to make the surgeons look good. So we make their procedures look good with the therapy that we do afterwards. So if you think about any other kind of surgical procedure you might do on your knee, perhaps on your hip, you need to do some preparation, some exercises beforehand, some exercises afterwards. Same thing goes here for speech. And then my last point I wanted to highlight is that I've talked generally about overall what we might see when we look at large groups, when we study big groups, but every plan is going to be individualized to your child, to the size of your child's cleft, to where their child's cleft is, to how they are as a person, how you are as a family. Everything is going to be individualized to you. So that be that the surgical procedures and any therapy that follows that. Where to from here? So the next slide I have is fairly similar to the one I had in my last, in our first webinar. So let me just skim through this. So your hospital-based cleft clinics and your cleft nurse specialists are going to be such a valuable source of information and support for you. And then you have your community therapists as well. We've got this wonderful series and 2 more sessions coming up. So if you're attending today, great. And the video, as Christina said, will be available on the Craniofacial Australia website. So if you need to come back and revisit any points, you can do that at a later point in time. We'll also have some written information that will come alongside these webinars as well, coming onto the Craniofacial Australia website in the coming months. And then all of these wonderful family supports that are available. Okay, I've hit the 31 minutes. Thank you very much. That brings us to the end of today. If you have any questions, pop them into the chat. And also, if you are, there's a feedback form here on this QR code. I'd be really grateful if you could fill that out. If you're planning to come to the next 2 sessions, you can just fill it out once at the end. And thank you again to Craniofacial Australia and the PKF Adelaide Foundation. And you can find me at Protea Therapy. And I do have a very short wait list at the moment, but that might not last for a long time. Okay, I have a question here about, I'm just going to read it out. Is it a concern that my 6-month-old can't blow a raspberry tongue in between lips? It's noted in the stages of development in our newborn blue book, and my GP made a comment about it today. So tongue between lips, I'm assuming you mean that kind of thing. They can't do that. It probably depends on a lot of other factors. And I know I'm sorry to say not be able to give you a really specific answer. But I wouldn't be running off to go and see a speech pathologist on this alone, but I would maybe just keep thinking about some of the things that I've talked about in terms of broader speech and language development. Definitely come along to the next session, because we're going to be talking about some things you can be doing and thinking about. And then that may raise some other questions for you that we can talk about then based on what I discuss in terms of what you can be doing. So sorry not to be able to give you a very clear response to that. And then another comment was a thank you. So thank you. I'm hope this has been helpful for your understanding as well. And thank you all for coming along.
Thank you everyone for coming along today. I'm sure you found this to be of value, and we look forward to seeing you in another fortnight, same time, same place on the 5th of March.
Awesome.
Right.
Thank you.
Thank you so much, everyone.
Bye. Enjoy the rest of your evening.
Bye. Bye all.